Nous voilà de retour pour la suite de ce webinaire sur l'intelligence artificielle en médecine. Nous avons vu en long et en large les thématiques du numérique, de l'intelligence artificielle, de la santé digitale, à la fois à l'hôpital, à la fois à l'université, en éducation et en médecine générale. Maintenant, c'est le moment de prendre un petit peu de la hauteur par rapport au domaine de l'innovation en médecine et en particulier quels sont les défis aujourd'hui et de demain du rapprochement des domaines de la technologie et de la médecine. Pour parler de cela, nous avons encore une fois deux speakers excellents, M. Nicolas Cauche qui est sur le panel avec nous aujourd'hui et le professeur Stevens, Hilde Stevens qui nous rejoint par Zoom pour nous parler de l'innovation et de l'apprentissage de l'innovation aux étudiants en médecine. Monsieur Cauche, vous êtes le directeur du Brussels Medical Device Center qui est issu de la collaboration proche des ingénieurs avec les médecins. Et vous allez nous parler justement de ce rapprochement pour mieux innover. Et votre présentation va suivre celle du professeur Stevens. Dr Hilde Stevens qui vient de l'I3H, l'Institute for Innovation, Interdisciplinary Innovation in Healthcare. Le professeur Stevens va nous parler de son expérience dans l'enseignement de l'innovation au sein du certificat en innovation en soins de santé. Dr Stevens, la parole est à vous. The floor is yours.
Thank you so much. Thank you, Giovanni, and the other organizers, of course. Thank you for having me and present the efforts of the Institute for Interdisciplinary Innovation in Healthcare, or in short, the I3H Institute, to contribute to this changing healthcare ecosystem with its various challenges and where innovation is needed more than ever, and where we as I3H Institute focused on research and education. That is truly our aim to contribute. So as we see here, 10 things we have to do to achieve precision medicine, an article written in Science dating from back in 2015. Well, there are many things that we need to do to move precision medicine forward. For example, indeed, a new taxonomy of diseases based on pathophysiology and biomarkers, novel clinical trial designs, really targeting subpopulations to the most extreme, going to trials where N equals 1. Data sharing, patient-reported outcomes, changing the way we look at regulatory sciences, but also, and very important, think about innovative financial schemes, how to incentivize companies to search more in, for example, orphan drugs and therapies, how to make sure that we don't with bringing drugs to the market that no one can pay for. And for this, all of this, we need a change in the medical education. And this is actually at the core of what the I3H Institute is doing. Here is the interdisciplinary team, which takes care of this educational program. And it has been, the I3H Institute has been founded for 6 years by Professor Michel Goldman, who you most likely know. And our institute aims to educate the next generation of healthcare professionals to help innovating and improving healthcare technologies and systems. It is our ambition to cross fields of expertise and optimize the use of each one's competencies to improve the patient's quality of life by delivering qualitative, and affordable healthcare, which is accessible to all people globally. And we are convinced that we need to target the next generations, the young ones, in their master years or early PhD researchers. And we really take it literally, targeting the young ones. By the next generation, we really mean those young ones. We are convinced that health literacy and understanding the responsibility of our different roles in the healthcare systems as citizens, as patients, as caregivers, and who knows, even actively involved in healthcare professionals. Whether it be as a researcher searching for a way to solve complex scientific issues, a biomedical engineer, a clinical research associate supervising clinical trials, as quality control manager, principal investigators, medical doctors, proposing the patient the option to participate in a clinical trial, or the nurse making sure that the patient is receiving the best care in the best circumstances, preferably in his or her house. So we also, for example, published this book for the young people aged 8 to 15 years to explain them all the challenges and to introduce them to, for example, the enormous effects and preventive effects of vaccines. So here is a quote of a science journalist at Young who offered an in-depth look at how the pandemic has altered the trajectory of science and its practitioners. COVID-19 could be the catalyst that fully reunifies the social and biological sides of medicine, bridging disciplines that have been separated for far too long. Well, the idea of crossing bridges and disciplines is obviously older than the COVID pandemic, but indeed, COVID has altered things. Children have never been confronted with the daily numbers of infections, hospitalizations, and deaths on a daily basis before. By now, most non-biomedically skilled people know much better than before what a vaccine actually does, what herd immunity is, and so on. And I'm talking then about the lay people. Never before have scientists from different horizons collaborated so hard with psychologists, economists, public health experts, and other disciplines. So let's hope that these silos that have been torn down by the COVID pandemic are not rebuilt again. Because we face incredible healthcare challenges, the need to innovate and speed up R&D processes has never been higher. The age of insular R&D organization is actually over. To serve as a company's innovation engine, the R&D strategy needs to be equipped for today's fast-moving world. The global investment in R&D is staggering. In 2019 alone, organizations around the world spent over 2 trillion euro on R&D, the equivalent of roughly 2% of global GDP, about half of which came from industry and the remainder from governments and academic institutions, which is the top 2 blue lines referring to the WHO European regions. And where are we actually with turning inventions into innovations that add value for the patient? Just an example, Alzheimer's disease has been described in 1906. And in the century since then, scientists have made remarkable strides in understanding how Alzheimer's affects the brain and learning how to make life better for affected individuals and their families. In the 80s, the awareness increased. In the 90s, the first therapies reached the market. And in the early 2000s, there was some progress and a lot of hope, but that's where it really stops. Billions of euros have been invested in searching a cure for Alzheimer's disease, and we have barely nothing. The cost of what does reach the market, putting increasing pressure on our healthcare budget. We all know that it's cheaper to invest in prevention rather than care. But where are we actually with putting more emphasis on preventing disease? As one of the most cost-effective ways of avoiding disease, vaccination prevents 2 to 3 million deaths a year, a number that could potentially be doubled if global coverage of vaccinations would further be improved, consequently bringing down the costs related to healthcare. In 2019, vaccine hesitancy has been declared as one of the 10 major threats for global health, which legitimates the need for coordinated action and collective intelligence of all stakeholders involved in vaccine strategies for the development and implementation, both on the national and the international level. So investment is needed, not only to bring new vaccines on the market, but also in research on the causes of the increasing numbers of anti-vaxxers or the rise in vaccine hesitancy. Despite the crisis and its devastating effects, we've seen incredible things happening, positive changes as well. Scientific progress at an unseen pace through the online availability of the virus sequence shortly after the first patient was diagnosed. We never brought so many vaccines in less than 1 year on the market. Of course, this is based on our knowledge from the developments in, for example, SARS-CoV-1. Never ever have, for example, been so many patients participating in clinical trials. Digital healthcare and decentralized trials have boosted, and an unseen number of public-private partnerships have brought vaccines more quickly to the patient. And I can go on for a while. The drug development cycle from knowledge generation to clinical application is very, very challenging. And here you see that it's not a straight line from basic research to improved patient outcome. It's a continuous process of going back and forth, and all different actors in the various phases need common information based on data collection and management, integration, knowledge management, delivery, and presentation. Interdisciplinarity and the need for continuously crossing boundaries and collaboration can and will advance innovation. And here you see, for example, what it takes from starting from the discovery of new molecule to really the patient access. You see that it's an iterative process. However, as you see, the different phases need to be connected. Even going further, it's really the process of going back and forth with data, improving previous stages. And here, we need to redefine the role of each stakeholder in health systems. The doctor is no longer the only one who can advise patients. Indeed, as I heard from the previous speakers, the role of nurses will also change. And here, artificial intelligence is really a tool that will be able to support medical practitioners to improve healthcare. And for this, an article written by Michelle Goldman, we need to move the boundaries to foster interdisciplinarity. We all have searched for a preliminary diagnosis for our health issues before going actually to the doctor. There's a huge evolution in the setup of decentralized clinical trials, where decentralization can help clinical trials becoming agile and efficient by reducing the administrative burdens on sponsors and those conducting trials. And it can allow patients to receive treatments from community providers without compromising the quality of the trial or the integrity of the data being collected. In the last years, the industry has rallied around the term decentralized clinical trials and expanded its definition to include all mobile, remote, home-based, or community provider-based solutions for collecting clinical outcomes data. But what are the drivers for this increased patient participation? For sure, people wanted an accelerated access to the vaccine in test phase, but still, without COVID, there would still be a slight increase. Patient preferences informing decision in all stages of the drug development cycle. And this is actually a whole new field of research that has developed over the past decade, and how to incorporate patient preferences in this drug development cycle. And this is actually a poll that we held through in one of our workshops amongst our program participants. And we see, we asked them what are the biggest challenges that we face. And we see that it's actually not digitalization. It's we see that access to health and medicine is of what they see as the biggest challenges, but also the prevention of disease. So what we do with our institute, we aim to develop further what's already inside the participants, their sound interest in healthcare innovation. And we do this by helping them to understand the different healthcare stakeholders' roles, facing them with the future transformations of care systems. We hope that through this program, they gain and further develop the interdisciplinary skills needed to address the variety of challenges that they will face throughout their careers, whether they be scientific, societal, managerial, of nature. Through this unique program, they have the unique opportunity to interact with various top-notch experts coming from different horizons. Our speakers are scientists, managers, patients, leaders, innovators, advisors, and investors, all sharing the same idea that they, the young ones at the start of their career, should benefit from an overview of the various challenges that accompany the drug development cycle, and hear about both failures and successes and get an insight in their lessons learned, so they can create opportunities and are knowledgeable about what it takes to help accelerate innovation in the biomedical field. So coming back to the mission and vision of the I3H Institute, which aims, as I said, at educating the next generation of healthcare professionals to efficiently contribute to development of innovative technologies and strategies by bridging competencies and expertise from various disciplines in order to contribute to patient-centered healthcare advances. So we introduce them into the concept of translational medicine and what it becomes or what it takes to become a translational scientist. In the program, we aim to introduce students in what it takes to become a system thinker, a skilled communicator, able to cross those boundaries, a rigorous scientist, a domain expert, a process innovator, and a team player. So they become more knowledgeable by discussing with people having experience and knowledge in other fields and become team players able to cross that boundaries. And they might, of course, benefit from learning from each other. Medical doctors, who are key contributors to the healthcare ecosystems, are challenged to evolve continually by obtaining new skills, help building new technology systems, and delivering more value to patients and other stakeholders, all while acting more efficiently and rapidly. Every few years, changes in the healthcare ecosystem drive a new set of needs. The impact of advancement in human science, technology, and data science, combined with the impact of the pandemic, have increased the urgency of this transformation and have made a new set of competencies, that of connected intelligence, essential. So this year we organize, well, at this very moment, we organize already the 7th edition of our program. And as you can see, we continuously invest in offering this program to all those interested. Over the past year, we grew both in terms of in number of students, as well as the backgrounds of those students. They come from various faculties, often in the biomedical field, of course, but also from, for example, from ICT, law, or social science faculties. So as you see at the bottom, all Belgian universities are included in this program. So they are offered the opportunity to follow this program. And every year we gain new partners. For example, this year we have people joining from, for example, the Rwanda Food and Drug Authority. Majority of our students are master students, but the number of PhD students and postdocs grows every year. And each year we also invite and welcome people who are already professionally active. So here we really force speakers to stay rather general, making sure that all those with various backgrounds, even non-medical backgrounds, can follow this program. And we get an enormous positive feedback from our students because they have the opportunity to speak with such top-notch experts. In this program, so we discuss the current and future challenges of the healthcare system. And in the context of today's seminar, I highlight the challenge of the application of AI in healthcare with the goal of learning to bring AI technologies into the clinic safely and ethically. Machine learning and artificial intelligence hold the potential to transform healthcare systems and open up a world of incredible promise. But we will never realize this potential of the technologies unless all stakeholders have basic competencies in both healthcare system transformation and understand big data or the potential of big data, artificial intelligence, and machine learning concepts and principles. This program is designed for both healthcare providers and those interested in healthcare innovation more generally, and we offer them really the insight to facilitate collaboration between the disciplines. The program is either a 5 credits program, but we also offer the participants to obtain a certificate in healthcare innovation, which of course is very interesting for those who have not a biomedical degree, biomedical scientist or medical doctors. for this certificate, to obtain the certificate, we also asked them to participate in 2 workshops, really defining a business strategy and learn new skills with respect to negotiations. So actually at this very moment, the workshop is ongoing and they play a board game to learn how business strategies are set up. So this was very short, the introduction to this interdisciplinary program in healthcare innovation. I hope that I convinced you that it's not our aim to make them all artificial intelligence experts, but at least that they understand that this is an application and tools that can support medical doctors in improving the quality they can bring to their patients. So if you have questions, don't hesitate to either visit our website at the bottom or send me a personal email and I will definitely come back to you with more answers. And I hope I met your expectations, Giovanni.
Thank you, Dr. Stevens, for this very comprehensive explanation of what the I3H has brought to medical students, other master students from other horizons, and PhD and postdocs on a comprehensive program that I followed myself when I was a medical student and that set me on the path to innovation. My question to you before we move on with the next presentation is, did you have feedback on various students, what they become after having followed such program? What are their career path?
Definitely. So indeed, we engage, as we do with you actually, we engage our program participants to really follow what we do with the I3H Institute, but we do also follow their careers through our alumni network. We try to engage them as we do with you, and thank you for accepting again to speak about artificial intelligence to our students. So we do, and we see that they end up actually in different sectors in the healthcare ecosystem, and they are generally very positive. They appreciate incredibly the idea that they are introduced into, for example, what an investor does, how important it is to already from the very start of doing basic research, it's important to think about the health technology assessment that will come afterwards, taking into account that they need to include data, not only medical data, but also the data needed to do this cost-benefit analysis later on and to bring these drugs to the market. So our feedback from those alumni is incredibly positive, and I can say that through the fact that we get requests like, can I please present my work as well in your program? And we increasingly do so, engaging them in our program as speakers. I think this is the proof that they appreciate that they had the opportunity to follow this program. And from a personal perspective, I followed biomedical sciences 20 years ago. Now, if I had such a course throughout my career, my student life, I would say it would have taken me more than 10 years to gather all the different insights and knowledge. I would have had this holistic view. I knew that I would definitely be much sooner interested in the strategy rather than doing basic science, because I'm not a scientist working in the lab. That's nothing that I aim for.
Thank you, Dr. Stevens, for this answer. And I wish you a very good day, and thank you for having participated into this webinar.
You're most welcome. And I hope you enjoy the rest of your day.